Welcome to Home Health Revealed, where we share real stories from industry leaders about home health, palliative, and hospice care. Brought to you by Velocity. Velocity's easy-to-read coding and revenue cycle dashboards let you grab your cup of coffee and quickly see the health of your organization.
All right, I'd like to welcome Katrina Reese from Enterprise Fleet Management. How you doing?
I'm doing well. How are you doing?
Yeah, I'm doing fantastic. How do you like the conference so far?
So far, it's been great. We've had a lot of traffic in the exhibit hall, which has been awesome to see. Just listen to the keynote around what's going on with government policy and the impact it's going to make on the members of the Alliance. So
now, is this the first time you've been to the financial conference? Or
it is.
Your first time?
I've been to this one before.
All right. Well, hey, tell
is
me.
Is it your first time?
No. So I'm old. I don't look it because I do Botox.
Oh yeah.
But
same.
I'm old. I can't sit Indian style anymore. But tell us a little bit about your company and what you guys do and how you help agencies.
Yeah, so Enterprise Fleet Management, most people know us as Enterprise Rent-A-Car, and we actually have 9 distinct business lines across our company, and I work with Enterprise Fleet Management. So our customers that are here actually in the home health and hospice space, we're reimbursing or doing car allowance for their nurses, and company car program actually provided some better cash flow for them, retention, recruiting tool for their nurses. So essentially what we do with Enterprise is we help them acquire vehicles, fund them, operate them, maintain like maintenance, fuel, and then help them sell the vehicles, and they get that equity back into their business. So
nice. So does it matter what state you're in, or do you guys serve all the states?
We serve all the states.
Okay.
We are decentralized, so we have groups across the states. We're like boots on the ground, account teams there to help our clients through financial analysis, improving operations, that kind of thing.
All that good stuff. Now, so as you know, a lot of agencies are still struggling to hire and keep staff. Is this a retention tool that you're seeing?
Yeah, absolutely. There's several studies that have been done that show that a company-provided vehicle is one of the largest perks that somebody, employee would like. We do company cars even within our own organization, and it is a really great way to save the employees money too. They don't have to go out and put the money into their own vehicles. We are, we're doing everything at scale, and we have strong buying power. So what we can buy our vehicles for versus someone out going and doing that on their own really helps save costs. And they're in reliable vehicles. A lot of times these vehicles that their nurses are driving aren't, and they get a call and they need to go and their car's breaking down. So the organizations can have more reliable vehicles for their staff and ensure that they're taking care of their patients.
Now, it sounds like, originally when you think about buying your fleet, your people, cars, immediately I think people would think, oh my gosh, that's got to be expensive. But there's some benefits to that.
There is.
And so what would you say to an agency that maybe has contemplated doing that, hasn't pulled the trigger yet? What could they expect if they called you guys and just to have a conversation?
I think a couple of ways that we look at this is initially it's a change for what they're doing, so not knowing what that looks like, and the administrative burden of what they're doing and keeping track of their reimbursement, and then they go into a car program. It definitely is still we still need them to support that and kind of administer that a little bit, but we really take it from there. Like it's more updates and stakeholder management for them than it is. We help them with license and title. Like you think about going to a DMV and how much of a pain that is. We help with all that. So they're not dealing with it now if they're doing reimbursement or allowance, but they still won't be doing it even with a car program. The financial savings can be quite a bit when they're reimbursing, I think 72 cents per mile right now, and you can run a fleet, all in for 55 cents per mile. So there can be substantial savings. I mean, think about 100,000 miles a year, over however many cars you have. It's a good chunk of change.
So if somebody was interested, how would they get in touch with you?
They could call. We have an 800 number, but go on our efleets.com I'd be happy to personally take a phone call. Can you and I leave my phone number?
Yeah. So what we'll do is we'll attach, when we release this podcast, which will probably be in a week or so, we'll make sure that we have your contact information on that so people don't have to try to search for it.
Yep.
And if they're interested in it, if you've been even contemplating it, I will tell you, I think there's wisdom in seeing what you guys are all about, what you can do. And maybe the timing may not be right, but but at some point it may be, and now they already know a little bit about you guys and how to go about that process, and I think it would be very wise that hey, if you're thinking about it, have the conversation, right?
Yeah, absolutely.
Yeah. Well,
I will just even listening to the State of the Union that we just had, where they were talking about the big beautiful bill, and really not big beautiful when it's going to do like billions are going to be cut in Medicare and Medicaid, and that's right now is the perfect time to just at least have a conversation about where they can look to cut costs, move money elsewhere, and really make an impact. Do more with less is what everybody's
seems
doing
like that's
right
the
now.
motto,
So
right?
it is
Yeah,
the
do
motto,
more or
right?
less.
Yeah.
Well, thank you for stopping by and chatting with us. I
Thanks,
appreciate
Michael.
you making time for that, and enjoy the rest of the conference.
Thanks. You too.
All right. See ya.